Okay, hello, my name is Miss Wood, and I'm your clinical instructor today, and today we're gonna talk about administering medication IV push through a continuous line. Okay, so that means with fluids hanging already. So the goal of of today is the prescribed medicine is given safely to the patient via a continuous intravenous route. Okay, so the first thing we're gonna do is we're gonna go just by the checklist. So make sure that you print off your checklist, and we'll just go down the line. Okay, so the first thing we're going to do is check the doctor's orders. Okay, so we're going to open the chart and check the doctor's orders, and it says Lasix 5 milligrams IV push per existing line. So that's what we're going to do today. Okay, so we're going to check clarify any inconsistencies, and there's no allergies written on here, so we'd have to find out if the patient's allergic to Lasix, so we'll ask the patient that when we go in the room, and we're gonna so now we're gonna wash our hands. So let's wash our hands and gather our supplies. The supplies that we're going to need is going to be a pair of gloves. Okay. The syringe or for the medication. So we can pick a syringe, and you want to make sure that you get a syringe that you know that the amount of medication that you're going to need is going to be, the syringe is big enough. And you can use any size needle to draw the fluid up because we're not going to use the needle. Okay, so and a blunt needle would work for this as well. So blunt needles are red and they're big, so we'd never use a blunt needle on a patient. So okay, and then 3 alcohol preps. We have those 3 alcohol preps. So we have our gloves, our syringe, and our 3 alcohol preps. Okay, then we're going to prepare our medication. So we're going to decide what medication we're going to use, and it said Lasix, and this says Lasix. We're going to check the expiration date to make sure it's not expired. Okay, and we're going to see that this our order says 5 milligrams. So, and this is 10 milligrams per mil, and we'd have to calculate the dose for this, and so that we know that this is 10 milligrams per mil, we're going to need half of that. So we're going to need a half of a mil. Okay, and you can use a calculator to calculate your dose if you need to, but you will have to calculate a dose for this IV push. Okay, so we're going to pop the lid on our medication, and we're going to use our alcohol prep, and we're going to scrub the hubba, wipe the top of the medication. So, and you remember how you are to withdraw medication from a vial. If you're going to use half of a mil, you have to put a half a mil of air into the vial and shoot it in, and then you can draw back a half a mil of medication, and you want to make sure that you get all the bubbles out. Okay, and that's how you draw out your medication, and then you want to cap your lid back. So now what we're going to do is we're going to label this medication before you take it anywhere out of the side of the bottle. You can either tape it to the tape the bottle if it's empty to the syringe, that's, you know, that, or you can write the dose and the medication and write it and label your medication. Actually label it before you take it out of the medication room. Okay, or you can actually prepare that medication in the patient's room, because now we have barcodes, and we'll have to barcode that or scan that barcode in the patient's room. So we're going to check we check the expiration date, we've labeled it, and we're going to consider the appropriateness for our patient. So consider if this Lasix is appropriate for your patient, if they have you know, a disease process going on, that they would have to have Lasix, and make sure that it's appropriate for your patient. Check the patient's drug allergies to be sure that the patient is not allergic to Lasix. So we would check the patient or check the chart, and then ask the patient when we go in the room if they're allergic to that. Okay, so then we're going to recheck. Remember, we have to check our medications 3 times, so make sure that you check 3 times. Lasix 5 milligrams IV push per existing line. We know that we have Lasix, and we've checked it, and we've drawn it up, and so we're going to take it into our patient's room, and then we'll recheck it again in the patient's room as well. Okay, so then we need to determine if the medication needs to be diluted, because Lots of times medications need to be diluted in the syringe before we actually give it to them. So we would have to look it up in our Davis Drug Guide or on your the computer that goes with you. Most hospitals have a pharmacy on there that you can look up and see if the medication needs to be diluted. This medication does not need to be diluted, so we will take the medication and the MAR, and we'll go into the patient's room. Okay. Now we're going to go into the patient's room. Knock, knock, knock. We're going to go in and we're going to wash our hands, and we're going to introduce ourselves to the patient and tell him that we're there to give him some medication. So we're going to explain the procedure to him or her and let them know that what we're here for. So we're also going to compare the MAR and the armband, and then we're going to ask our patient to state their name and date of birth. Okay, so we're going to use our two identifiers again, which are their name, and his name is Samuel Neal, and also ask him his date of birth, and they should match. It should match on the armband. It should match on your MAR. So that's what we know. Then we're going to also ask him about any drug allergies, if he's allergic to any kind of medication, and make sure that our Lasix is compatible to his IV fluids, because we've already checked that in the MAR. In the Davis Drug Guide. So we checked in the Davis Drug Guide to make sure that the medication that he's administered, that's being administered through this IV line, is compatible with our Lasix, and also that if we needed to dilute it, and we didn't need to dilute it, and our normal saline is compatible to Lasix, so we can give our medication. So okay, we're in the patient's room, and we're going to apply clean gloves. Okay. Now we're going to go to the port that's the closest to the insertion site of the IV, okay, and we're going to clean that hub for 15 seconds to make sure that we get it good and clean. Then you take the needle off, because we don't need the needle, because we don't want to poke a needle into that port, and your Luer lock is going to fit right on to that port, okay, just like that. And then you're going to your medication is to be pushed at a rate, and we've looked up that rate in the Davis Drug Guide, so we know what that rate should be. So Lasix, and so we're going to push a little bit according to our time. We're going to pinch, okay, look, and we're going to pinch above the port so that the medication is going to go into the port, so we're at that angle. So we're going to pinch, and we're going to push at the rate that we've looked up for and made sure that we have, and then we're going to let go, and then we're going to let the fluid flow in, and then we're going to pinch again, push a little more, and we're going to do that and let go, and we're going to do that until all the medication is into the port. Okay, so you're just going to continue to do it until your medication has all been put into the line. Okay, so just pinch, and you're going to go slowly and time it as you go to make sure that you go in at the time that's set. Okay, and when that's done, then you're going to undo your syringe from that port, and then you're going to check and make sure that there's going to check again for infiltration, and make sure the whole time that you're pushing the medication, you're going to be watching that site to make sure that you don't cause any infiltration. You're going to be assessing your patient and making sure that the medication is not causing any ill effects to the patient. Okay, and then you're going to clean up your mess, throw away your needle, and dispose of the equipment, and then we're going to take off our gloves, okay, throw them in the trash, wash our hands, and make sure our patient is comfortable. Make sure the bed is in the lowest and locked position, the side rails are up ×2, and the patient has his call bell. And you're going to thank the patient for that, allowing you to give him his medication, and ask him if there's anything else that he needs, and then go out of the room. And then you're going to, as you go out into the room, you're going to document, okay? And you're going to document the date and the time the medication was administered, the name and the dose of the medication, okay? The location and the appropriateness of the appearance of the IV site before and after you gave the medication, because you want to make sure that you document that what it looked like before and what it looked like after you finished giving the medication, and then how the patient tolerated the medication and tolerated the procedure. Okay, thank you very much. Good.